Hey everyone, it's Dr. Mike, and thank you for tuning in to Diabetes Daily Dose. Today we are talking about a serious subject, the potential heart risks associated with certain diabetes medications. Our goal is to empower you with knowledge about your health. Remember, this video is for informational purposes only, and it should not be considered medical advice. As always, you should consult with your doctor to determine the best course of treatment for your individual needs. Managing diabetes is about more than just controlling blood sugar. It's about protecting your overall health, and that includes your heart. So let's dive in. Don't forget to hit that like button, subscribe to the channel for more informative videos, and leave a comment down below with any questions or topics you'd like me to cover in the future. The first drug on our list is pioglitazone, often sold under the brand name Actos. It belongs to a class of medications called thiazolidinediones, or TZDs for short. Pioglitazone works by improving the body's sensitivity to insulin, which is the key hormone that helps regulate blood sugar levels. By improving insulin sensitivity, this medication can help lower blood sugar in people with type 2 diabetes who don't produce enough insulin or whose bodies don't use it effectively. It is important to note that pioglitazone is not typically the first-line treatment for type 2 diabetes. Doctors usually prescribe it when other medications, like metformin, haven't been effective enough in controlling blood sugar levels. While pioglitazone can be effective in managing blood sugar, it's crucial to be aware of its potential side effects, particularly the increased risk of heart failure. Heart failure is a serious condition where the heart can't pump blood effectively throughout the body. It can lead to fatigue, shortness of breath, and fluid buildup in the lungs or legs. Several factors can contribute to heart failure, including high blood pressure, coronary artery disease, and certain medications. Studies have shown that pioglitazone use may be associated with a higher risk of developing heart failure, especially in people who already have some degree of heart disease. The exact reason for this link isn't fully understood, but it could be related to fluid retention caused by the medication. Now, I know this information might sound concerning, but it's important to remember that not everyone who takes pioglitazone will develop heart failure. If your doctor has prescribed pioglitazone for your diabetes, don't panic or stop taking it without first consulting with them. They will carefully consider your individual risk factors, including your medical history and the presence of any pre-existing heart conditions. If you're taking pioglitazone, it's essential to be aware of the potential symptoms of heart failure, such as shortness of breath, swelling in your legs or ankles, and sudden weight gain. If you experience any of these symptoms, contact your doctor immediately. Let's move on to the next medication on our list, rosiglitazone, commonly known by the brand name Avandia. Like pioglitazone, rosiglitazone also belongs to the thiazolidinedione (TZD) class of drugs, and works in a similar way to improve insulin sensitivity. Rosiglitazone was once a widely prescribed diabetes medication, but its use has significantly declined due to safety concerns, particularly regarding its potential cardiovascular risks. Rosiglitazone became the center of major controversy in the late 2000s when studies began to emerge, suggesting a possible link between the drug and an increased risk of heart attacks. This controversy led to much debate and scrutiny from the medical community and regulatory agencies like the FDA. As a result, the FDA placed restrictions on the use of rosiglitazone, making it available only through a restricted program that requires both prescribers and patients to enroll. While rosiglitazone is still available, its use has dramatically decreased due to these safety concerns and the availability of other diabetes medications with more favorable safety profiles. If you have been prescribed rosiglitazone in the past or are currently taking it, it's essential to have an open and honest conversation with your doctor about the potential risks and benefits. They can help you weigh the risks and benefits of continuing the medication or exploring alternative treatment options based on your individual circumstances and medical history. Hey everyone, Dr. Mike here. Today we're going to take a closer look at saxagliptin, a medication that's often prescribed to help manage type 2 diabetes. This medication is part of a class of drugs known as DPP-4 inhibitors, which work by increasing the levels of incretin hormones in the body. These hormones help to regulate blood sugar levels, making saxagliptin an important tool in the fight against diabetes. In this chapter, we're diving deep into saxagliptin, a commonly prescribed diabetes medication. Saxagliptin is marketed under the brand name Onglyza and has been used by millions of patients worldwide. It's known for its ability to help control blood sugar levels, but like all medications, it comes with its own set of potential risks and benefits. As with any medication, understanding the potential risks is crucial for both patients and healthcare providers. When it comes to saxagliptin, one of the primary concerns that has been raised is its potential impact on heart health. This is particularly important because people with diabetes are already at a higher risk for cardiovascular issues. Our focus here is on understanding the relationship between saxagliptin and heart health. Over the years, several studies have been conducted to investigate this link, and the results have been somewhat mixed. Some studies suggest that there may be an increased risk of heart failure associated with saxagliptin, while others have not found a significant connection. Now you might be wondering, why all the fuss about heart health when we're talking about diabetes medication? The reason is that managing diabetes is not just about controlling blood sugar levels. It's also about reducing the overall risk of complications, including those related to the heart. Cardiovascular disease is one of the leading causes of death in people with diabetes, so it's essential to consider the heart health implications of any diabetes medication. Well, studies have shown a possible link between saxagliptin and an increased risk of heart failure. This doesn't mean that everyone who takes saxagliptin will experience heart problems, but it does suggest that there may be a slightly elevated risk for some patients. It's important to weigh this potential risk against the benefits of the medication, which can be significant in terms of blood sugar control. It's important to note that this doesn't mean everyone who takes saxagliptin will develop heart problems. Each patient's situation is unique, and the decision to use saxagliptin should be made in consultation with a healthcare provider who can assess the individual risks and benefits. Factors such as a patient's overall health, other medications they may be taking, and their specific diabetes management needs all play a role in this decision. It simply means that statistically, there might be a slightly elevated risk. The data suggests that for every 1,000 patients treated with saxagliptin, there may be an additional 3 cases of heart failure. While this number may seem small, it's significant enough to warrant careful consideration and discussion between patients and their doctors. Our goal here is to empower you with the information you need to have informed conversations with your doctor. If you're currently taking saxagliptin or considering it as a treatment option, it's important to discuss any concerns you may have about heart health with your healthcare provider. They can help you understand the risks and benefits in the context of your overall health and treatment goals. Remember, this video is for informational purposes only and shouldn't be taken as direct medical advice. The information provided here is based on current research and clinical guidelines, but individual treatment decisions should always be made in consultation with a healthcare professional who knows your specific medical history and needs. Always consult with your doctor before making any changes to your treatment plan. Your doctor can provide personalized advice and help you weigh the potential risks and benefits of saxagliptin or any other medication. They can also monitor your health and make adjustments to your treatment plan as needed to ensure the best possible outcomes. In the next section, we'll be breaking down some of the key findings from clinical trials that have investigated the relationship between saxagliptin and heart health. We'll look at the methodologies used in these studies, the results they found, and what they mean for patients and healthcare providers. Stay tuned as we continue to explore the complex and important topic of diabetes management and heart health. One of the largest studies that evaluated saxagliptin involved over 16,000 patients with type 2 diabetes. This was a randomized, double-blind, placebo-controlled trial, the gold standard in medical research. Patients were divided into 2 groups, one receiving saxagliptin and the other a placebo, in addition to their standard diabetes care. The study followed these patients for a median duration of 2 years, meticulously tracking cardiovascular events. While the study didn't show a statistically significant increase in the overall risk of major adverse cardiovascular events, it did raise some eyebrows. There was a slight uptick in the rate of hospitalization for heart failure in the saxagliptin group compared to the placebo group. So what does this all mean for you? If you're currently taking saxagliptin and are concerned about the potential heart risks, don't stop taking your medication abruptly. Instead, schedule an appointment with your doctor to discuss your concerns. They can help you weigh the benefits of saxagliptin in controlling your blood sugar levels against the potential cardiovascular risks. Remember, uncontrolled diabetes carries its own set of serious health complications, including heart disease. Your doctor might consider several factors when evaluating your risk, such as your medical history, family history of heart disease, age, and lifestyle. They may suggest adjustments to your treatment plan, potentially switching to a different medication, or recommending lifestyle modifications. The key takeaway here is that managing diabetes is a team effort. All right, moving on to number 4 on our list, sitagliptin. This medication falls under the DPP-4 inhibitor class, similar to saxagliptin, which we just discussed. Now, sitagliptin is often prescribed to help manage blood sugar levels in people with type 2 diabetes. It works by increasing the body's production of insulin and decreasing the amount of glucose produced by the liver. Sounds like a good thing, right? Well, here's the catch. While generally considered safe and effective, some studies have suggested a possible link between sitagliptin and an increased risk of heart failure, particularly in individuals who already have heart problems. It's important to understand that correlation doesn't equal causation. Just because some studies have shown this association doesn't mean sitagliptin directly causes heart failure. So let's dive a little deeper into the research. One large clinical trial called TECOS studied the effects of sitagliptin on cardiovascular outcomes in over 14,000 patients with type 2 diabetes and a history of cardiovascular disease. The good news is that the TECOS trial didn't find a significant increase in the risk of heart failure in patients taking sitagliptin compared to those taking a placebo. However, other studies have shown a potential link, particularly in specific patient populations. This is where things get a bit complicated, as is often the case with medical research. Different studies can have varying results due to a number of factors, including the study design, patient population, and other medications being taken. So, what does this all mean for you if you're currently taking sitagliptin, or if your doctor is considering prescribing it to you? The most important thing is to have an open and honest conversation with your healthcare provider. They can assess your individual risk factors, such as your medical history, current medications, and lifestyle. Together, you can weigh the potential benefits of sitagliptin against the possible risks. Remember, managing diabetes is a team effort. Don't hesitate to ask questions, voice your concerns, and be an active participant in your healthcare journey. Last but not least, let's talk about canagliflozin. This medication belongs to a class of drugs called SGLT2 inhibitors. Now, canagliflozin works in a unique way compared to the other drugs we've discussed. Instead of affecting insulin or glucagon, it helps your kidneys remove excess glucose from your bloodstream through your urine. This can be an effective way to lower blood sugar levels in individuals with type 2 diabetes. However, recent research has raised some concerns about a potential link between canagliflozin and an increased risk of heart failure, particularly in patients with pre-existing heart conditions. So what does the research say? A large clinical trial called CANVAS studied the cardiovascular safety of canagliflozin in over 10,000 patients with type 2 diabetes and a high risk of cardiovascular events. The study found that while canagliflozin did not increase the risk of major adverse cardiovascular events, there was a small but statistically significant increase in the risk of hospitalization for heart failure in patients taking the drug. Now, it's important to emphasize that the overall risk of heart failure was still relatively low in both groups, those taking canagliflozin and those taking a placebo. As with any medication, it's crucial to weigh the potential benefits of canagliflozin against the possible risks. If you're considering this medication or are currently taking it, It's essential to have a conversation with your doctor. They can help you understand your individual risk factors and determine if canagliflozin is the right choice for you. They can also monitor you closely for any signs or symptoms of heart failure while you're on the medication. Remember, managing diabetes effectively requires a personalized approach. We've covered a lot of ground today, discussing 5 different diabetes medications and their potential links to heart failure. It's important to remember that this video is not intended to scare you or to encourage you to stop taking your prescribed medications. Instead, my goal is to empower you with knowledge so that you can make informed decisions about your health in collaboration with your healthcare provider. If you have any concerns about the medications we discussed today or any other aspect of your diabetes management, please don't hesitate to reach out to your doctor or another qualified healthcare professional.